Okay, I'm quickly going to talk to you about menstrual cups. So firstly, what are they? They are a cup made out of medical grade silicone. They're a flexible, reusable alternative to tampons. The medical grade silicone has natural antibacterial properties and does not absorb anything, so it has not been associated with toxic shock syndrome. Some of the things to consider when buying your cup is whether the silicone is FDA approved, whether you have had a baby or how old you are, because that will determine what size you need, and whether you have a low cervix or not, because that could affect what shape you choose. I'll talk about how to choose the perfect menstrual cup in another video. So for now, I'm just going to cover how to insert. So if you have a look at female anatomy, if you're squeamish, this is probably the point to stop the video. Okay, so here you have your rectum and your intestines. This is your vagina with a cup there. And this is your uterus, and then this is your bladder. So can you see that it sits in your vagina between the entrance to your uterus, so this is your cervix, and the entrance to your vagina. It is nice and pliable, so it doesn't matter what shape you are, it's going to mold to your body. So the first thing you do is you need to fold it. There's two ways to do that. You can fold it in half and then in half again, creating a C shape. You can also punch down this side and fold at the top, making it pointy. Okay, so I'm going to show you using a C shape. You make your C shape. You're sitting down or squatting. This is the easiest as it brings your cervix lower. You then push it in and you let go. It should pop open. If it doesn't pop open, okay, the first way to check if it has popped open is just to run your finger along the base. If you feel it hasn't popped open, you can then twist, or you can push while bearing down. This not only will help the cup pop open, because you'll push with your muscles, push with your finger, and then relax. It will also help get the cup into a comfortable position. Okay, if that doesn't work, you can then pinch the bottom of the cup, pull it out a little, turn, and push it back in. Okay, so that's getting it in. Once it's in, you can then decide whether you need to have the tip here. So depending on how high your cervix sits, you might need to cut off some of these if you feel they're sticking out and they're uncomfortable. So I even have customers who cut the whole thing completely off because their cervix is a bit low. Please, when you're cutting the cup, make sure that you don't cut the bottom of the cup, then you're actually just destroying it. Okay, then 8 to 12 hours later, depending on your flow, you would need to take it out and rinse it. When you're taking it out, it does help to bear down with your muscles because that pushes the cup back towards the entrance of your vagina. You can then pinch the bottom and you just break the seal and then pull it out. Keep it sort of vertical so that you're not dripping blood, and then just tip it into the toilet. Helps to do this on the toilet. If you're a bit squeamish and you don't want blood getting into your sink, you would then use some toilet paper and you would dab the inside just to get what hasn't come out into the toilet completely out, and then take it to the sink and rinse it with hot water. You can use a mild soap, but it's not necessary. Then once you've rinsed it, you then need to wash your hands. So place the cup on a piece of toilet paper while you do that. That'll ensure it keeps clean. I like to keep the cup wet because it makes the insertion better, easier once you try and insert it again. So when it's wet, it is easier to insert. So the first time you insert it, it's actually a good idea to just run it under some hot water. Okay, and then you just go through the process again. You sit down or squat down and you insert and you let go. It's really easy, and depending on your flow, you might only have to change it once a day. So it really can be a nice alternative to tampons.